And joining us now is Dr. Geoffrey Mount Varner. He's an emergency room physician, and he's also a decisions expert. And it looks like we also have pediatrician and public health expert, Dr. Yolandra Hancock. Always a pleasure having both of you. Now, since I don't see Dr. Hancock, because as you know, Dr. Varner, it's always ladies first, we'll start with you by default. Researchers are hopeful that this new technology can be supplemental for vaccines, particularly in people with weaker immune systems. Can I get your reaction to that? And is that a potential game changer at this point?
Yes, and thank you for the question, and thank you for having me. That is definitely a potential game changer. But first, we have to recognize that it's number one is still the vaccine. But then this is extra because what this does is it introduces antibodies into the body that's able to go into small parts of the spike protein of the COVID virus and neutralize it. And so far, the studies are looking good. And it also is so small that it can be aerosolized, meaning that someone can be able to breathe it in and it be effective as well.
Okay, so Dr. Yolandra, just to piggyback off of that, what type of mask will protect us against these new variants that are circulating?
That's an excellent question. You know, the recommendation is the N95 mask for both adults and for kids. Back at the beginning of the pandemic last year, because we were running so short as a result of folks hoarding the masks, it was hard to come by. And so the recommendation in the lay public was just to use a surgical mask, cloth mask, whatever you could get your hands on. But now that we have sufficient supply, the recommendation truly is for an N95. If you cannot wear an N95 mask, if you cannot find an N95 mask, certainly utilizing a cloth mask with a double layer of protection, either single fabric with a filter or having a double layer of fabric with your mask is going to provide you with the best protection. And most importantly, you want to wear a mask that fits well. There's nothing worse than a loose-fitting mask. You might as well not wear one.
All right, and I want to actually stay with you for this next question because kids are returning to the classroom across the country, and we're seeing cases surge. According to the American Academy of Pediatrics, there were about 38,000 cases a week near the end of July. What do you say to that? And are you also seeing an increase where you are?
Absolutely. The American Academy of Pediatrics just reported out that there was a max of 180,000 new cases. Throughout the pandemic, children have made up nearly 15% of COVID-19 cases. As of the week of August 19th, children made up close to 23% of COVID-19 cases. And on August 19th, we actually broke a record with 1,900 children being hospitalized that day. And so we're seeing the numbers rise in terms of the number of cases. We're seeing numbers rise in terms of the number of children who are admitted to the hospital. And it isn't just COVID. There's this dual combination of COVID-19 and a virus that we're very familiar with, the respiratory syncytial virus, something called RSV. Both of these viruses are bringing our children to the hospital and requiring them to require several days of hospitalization. Here in the DMV, we're certainly seeing more RSV than we are COVID, but we are seeing a combination of both of those.
And Dr. Varner, I want to ask you as an ER physician, can you tell our audience what the difference is when you treat, and I want to obviously make this specific to Black people because we are less than 10% of us are fully vaccinated. We also have underlying health conditions as well. What is the difference between treating someone who is vaccinated versus someone who was unvaccinated when they catch COVID?
That is an excellent question. The difference is night and day. When I treat someone who is unvaccinated, so far about 99.9% of the time, I treat them and I send them home. But for the unvaccinated, they are the ones who are more likely to get a tube placed down their throat and sent to the ICU, or at least admitted to the ICU. So it makes a humongous difference of whether or not you're vaccinated or vaccinated, and that data is bearing out across the nation as well.
Yeah, and Dr. Hancock, for you, because we know we've had this conversation plenty of times, children under 12, they are unable to be vaccinated. So what are you seeing when it comes to an unvaccinated child with COVID versus a vaccinated child?
What we're seeing, the beauty of pediatrics is that even in the face of being unvaccinated with little ones who are exposed to COVID, the majority of children are still having very minimal symptoms, even with this Delta variant. It's just the number of children that are impacted by Delta variant. Certainly those who have comorbid conditions, some of the ones that you just mentioned, especially within communities of color, children dealing with obesity, children dealing with type 2 diabetes, and high blood pressure are at increased risk. So of the children who are hospitalized, those who have any of those chronic diseases, we're seeing them have much more severe disease. For that reason, it's really important for parents to make sure that they're maintaining healthy habits for their children, especially for those who have any of those chronic diseases that we just mentioned.
All right. Well, this question is for the both of you. We just noticed the FDA, or excuse me, the FDA just approved Pfizer full approval. When can we expect to see a vaccine approval or at least emergency authorization for children under 12? Dr. Varner, we'll start with you.
Well, currently they have completed phase 3 trials as it relates to children under 12, and actually it's 5 to 11. They have completed those phase 3 trials, and they're going through the data now. While I don't have any evidence base for this, I am under the impression that we can expect to see a rollout late fall, early winter. But the studies are doing. But the studies are done, and so far the data is looking promising.
Oh, that's just so scary. I mean, you think about the reports that we recently heard in Hillsborough County, 10,000 students and staff members forced to quarantine after exposure, and we still have several months before this vaccine is going to be available to them. Not to mention, it still takes, what, 2 months for your body to fully adhere to it, to where you're fully vaccinated and protected. Oh, all right, it makes me anxious, and I don't even have a child. But with that being said, we'll come back. We'll have this conversation after the break. I'm sure there are a lot of parents that still have a lot of questions for you both. So thanks for staying with us. We'll be right back. You're watching BNC Live.